Hello, everyone. My name is David Devereaux, and I was a counseling intern at the Angelo State University Counseling Center. Today, we're going to have a webinar on the psychological impact of COVID-19 and its antecedents. What are the costs of reducing the spread, and what are some of the things that led up to our response to COVID that had the long-haul consequences? Psychological effects go beyond just grief from loss. We've lost over 1 million Americans to COVID, and as you can tell by the breakdown, age is a major risk factor. While the traditional student age was one of the least impacted groups when looking at fatalities, they have also been hit with mental health challenges. We're going to take a look at each one of these impacts and see how they contributed to the decline of many students' mental health over the last 2 years on and off campus. While some of these may or may not touch our lives personally, each one of these can collectively add to an increased stress burden, resulting in frustration, depression, or anxiety. But you're not alone. We will discuss some of the steps you can take to mitigate some of these negative psychological effects. But for now, let's take a look at what some of these effects are. The global impact: we saw financial destabilization in US, China, Japan, India, UK, and Australia. Job loss, especially among college-aged students. Inflation and disruptions to the supply chain. The societal consequences were increased demand for healthcare services, denial or limitation of other healthcare services, school closures and a shift to virtual learning, and church closures. For the interpersonal implications, we saw shelter-in-place orders and lockdown, mask mandates, vaccine requirements, and child abuse and interpersonal violence. 1/3 of students sought mental health services due to COVID-19 pandemic, whereas 2/3 did not. In other words, the majority of students seeking mental health care did so for reasons other than COVID. Regardless of the reason for seeking mental health care, the vast majority of students seeking mental health care reported that COVID-19 has negatively impacted at least one aspect of life. 94% with mental health, 72% with motivation and focus, 68% loneliness or isolation, 67% academics, 66% missed experiences and opportunities, and 60% as the most frequently affected areas. These will be critical aspects for the university experience for colleges and universities to focus on in the coming months. It is worth noting that 28% of students seeking mental health services report that COVID-19 did not negatively impact their health. From time to time, you will see variations in percentages due to various time different studies were done and data was collected.
Finally, tonight, we look at how the pandemic is affecting the mental health of college students. Students have long been prone to stress, anxiety, and depression. According to the CDC, 3 out of 4 Americans between the ages of 18 and 24 report poor mental health tied to the pandemic. Hari Srinivasan has our story. It's part of our ongoing series, Rethinking College, and a warning for some viewers. This story deals with the subject of suicide.
The nights leading up to it had shown that there was going to be some sort of culmination. And that night, I was kind of worried that I was going to do something that I might regret.
19-year-old Victoria Canales was alone the night she almost gave up everything. Alone in a 3-bedroom apartment in Austin near the University of Texas campus. No friends, her roommate stayed home fall semester. No family, they were hundreds of miles away in Laredo. Panic led her to stop taking her antidepressant medication, and her good grades were slipping away too. Unsure where else to turn, Canales dialed her school's crisis hotline.
I told them, I'm feeling pretty bad. I'm not doing too well in my classes. I'd kind of just like somebody to talk to.
They kept her on the phone for an hour and a half.
And then by the end of it, she told me, I would like to be able to hang up and know that everything's going to be okay. But based on kind of what we were talking about tonight, I think I'd like to send the campus mental health officers over just to go check and make sure that everything is okay.
They sent someone over, and Canales decided in that moment to make some changes because she was not okay. Many students are not right now. Drop a pin on a map of the U.S. and the story is much the same. Heightened isolation, depression, anxiety, mental health crises, courtesy of a college experience stripped almost entirely of campus life, tradition, and structure, on top of a pandemic.
College seems like a really far away concept right now.
No matter who you are, it really sucks.
It's really messed with my head in ways I never thought possible.
It's hard to sleep at night because you just sit in your apartment all day. I think almost all of my friends have started going to therapy since the semester started.
More than 560,000 undergraduate students did not enroll this fall compared to 2019. Even in normal times, those who report mental health struggles are nearly twice as likely to drop out of school than their peers. There are stressors for those studying remotely.
It's very exhausting. Definitely, Zoom fatigue is real.
And for those making the trek into classrooms.
Since I commute a lot, I try to be as careful as possible, especially knowing that a few of the people that I know that has gotten the virus have been really, really sick. They were very near to death.
1 in 4 Americans between the ages of 18 and 24 reported having seriously considered suicide in the last 30 days, according to the CDC. And nearly 70% of college presidents now say student mental health ranks among their top concerns.
I think for a lot of us, it's just been sort of feeling like a bit of a loss of that experience.
Yeah, been an incredible challenge.
Varun Soni is the vice provost for campus wellness and crisis intervention at the University of Southern California.
Before COVID, students were already struggling with anxiety, depression, and loneliness, and that has only been exacerbated.
In fact, Soni says before the pandemic, 65% of college students were wrestling with anxiety, 30% with a mental health condition, and 10% with thoughts of suicide. Soni says the string of recent American crises, combined with an over-reliance on technology and social media, are making today's young people more anxious than ever before. COVID isolation has made it worse.
We're tribal people as human beings. We need a tribe, and college is a place where many students find their tribe. And so I think for a number of students, 80% of students around the country say that COVID has negatively impacted their mental health, their spiritual health, and their career aspirations.
Young people like Jasmine Guerrero, a junior at California State University at Northridge, say the main problem is students feel like they're in all of this alone, emotionally and academically.
It's been rough this semester.
I don't even feel like I'm learning crap.
Yeah. We attend campus to learn and to network, and we're just getting learning. I know a lot of people that say, hey, I'm just turning in assignments without even knowing if the information is staying in with me,
I met up with Dr. Mickey Sharma on Ohio State University's famous Oval, usually packed with students, now largely deserted. Here, at one of the biggest schools in the nation, student plans have been altered by the tens of thousands. They won't get those experiences back. Sharma directs OSU's Student Life Counseling and Consultation Service.
How do you help them get over the fact that they had plans? The plans changed.
The first thing we do is validate the student's feelings is real. What you're talking about is loss. I would say to the student, instead of focusing on things being normal again, what I want you to focus on is creating your new normal. We can proactively be a part of what we want the future to be.
Did you meet your goals? How do you feel after this full semester online?
Most schools offer mental health and academic counseling for students, but virtual and in-person visits against expectations have been either flat or down for many schools. And that's another sign of trouble, says Varun Soni at USC.
So I think all universities are concerned about what's happening in home environments, in remote environments, abroad, because we're not as connected as we used to be. I think what all of my colleagues around the country are wrestling with is, what are we not seeing?
This is my first mariachi gig.
Victoria Canales says spring semester at the University of Texas could be a repeat of fall. Not much has changed about her situation.
So I've been seeing my therapist, and it's been a really good experience. I also got back on my antidepressants.
She also plans to take fewer classes and find more time for fun.
I do want to spend more time kind of like on the things that I enjoy. I love music. I love playing instruments. Hopefully next semester I'm just going to try and push myself to do the things that I know I will enjoy. I don't know. We'll see.
She'll take it a little easier on herself and take the days one at a time until things get back to normal. For the PBS NewsHour, I'm Hari Srinivas.
If you or someone you know needs help, the National Suicide Prevention Lifeline is available 24 hours a day. Write this down. Call 1-800-273-8255.
The virus has impacted the financial stability of countries worldwide. The Asian Development Bank announced in May 2020 that COVID-19 could cost the global economy between $5.8 and $8.8 trillion. Christine Lagarde, president of the European Central Bank, warned in April 2020 that the Eurozone's economy could shrink by as much as 12% in 2020. In August, there were 15 million unemployed people in the European Union, which is an increase of 700,000 since April of 2020. In April 2020, reported that the Chinese companies posted their weakest corporate earnings in a decade in the first quarter of 2020. In September, the New York Times reported that India's economy shrank faster than most other countries, and estimates predicted that 200 million people could slip back into poverty. Japan's household spending fell 6% in March 2020 from the previous year, the biggest decline in 5 years. Japan's gross domestic product contracted 27.8% from April 2020 to June 2020, the third straight quarterly decrease and the biggest decline in post-war history. The UK's economy contracted 20.4% in the second half of 2020, and after nearly 30 years of growth, Australia fell into a recession after its economy shrank 7% in the second quarter of 2020. The decline in quarterly gross domestic product is the largest since record-keeping began in 1959. In addition, South Korea officially entered a recession in August 2020, the first in 17 years. According to the Bureau of Economic Analysis, the gross domestic product for the United States decreased at an annual rate of 48% for the first quarter of 2020 and 32.9% in the second quarter. Consumer spending in the United States decreased 10% in 2020 compared with 2019, and more than 17 million Americans have filed for unemployment. How does this affect colleges? Future college and university enrollment and student mobility cannot be unbundled from the economic reality. Allocations for faculty research, course development, and international collaboration cannot be separated from declining enrollments and decreased national and state funding. In September 2020, the Australian National University said it would eliminate 215 jobs in order to mitigate the estimated budget shortfall for the academic year. Some universities, including Georgetown University, will not make contributions to employees' retirement funds for a year. According to a May 2020 poll, 62% of all college and university presidents in the United States plan to reduce their workforce. In addition, according to a survey of American business schools during the last week of March 2020, 93% of responding business school deans reported that they believe the pandemic will accelerate the closure of several business schools in the United States. Consumer spending, including higher education spending, will decline as a result of economic contractions in a post-COVID-19 world. Inflation. Consumer prices in the United States continued to rise in February of 2020 to after inflation had hit a 40-year high in January. The Consumer Price Index for all urban consumers was up 7.9% compared to a year ago, while the core index, excluding more volatile food and energy prices, increased 6.4% over the last 12 months. Joblessness. We're seeing a rebound to pre-COVID-19 levels. 6.9% in April 2020 was pretty staggering and contributed to many people's feelings of hopelessness, anxiety, and frustration. While the U.S. unemployment rate has dropped to 4.7% from a post-World War II high of 14.7% in April, it remains well into the double digits for teens and workers in their early 20s, according to a Bureau of Labor Statistics. Based on the demographics of workers in high-risk industries, young people in particular are set to be disproportionately affected by virus-related layoffs. Among the 19.3 million workers aged 16 to 24 in the economy overall, 19.2 million, or nearly half, are employed in the service sector establishments. Younger workers make up 24% of employment in high-risk industries overall, and many establishments in these industries are facing a likelihood of closure in areas with more severe COVID outbreaks. Supply chain. How many times have you been to the store and could not find what you needed or wanted? Or how about that $75 part you needed to fix your car? If you could find it now, it costs almost $300 due to a lack of supply from the breakdown in the supply chain. In 2021, as a consequence of the pandemic, global supply chains and shipments slowed, causing worldwide shortages and affecting consumer patterns. Causes of the economic slowdown included workers becoming sick with COVID, as well as mandates and restrictions affecting the availability of staff. Manufacturing facilities were forced to close due to state and local governments following CDC guidelines laser focused on stopping the spread, but factoring in little else. In cargo shipping, goods remained at port due to staffing shortages as well as labor shortages in the transportation sector. The related global chip shortage has contributed to the supply chain crisis, specifically in the automobile and electronic sectors. During the Christmas holiday season of 2021, an increase in spending in North America, combined with the spread of the Omicron variant of COVID-19, further exacerbated already tight supplies. Long tail effects of the supply chain crises are contributing to ongoing food security issues related to the pandemic, including the 2022 food crisis. We saw a denial or limitation of some healthcare services, such as elective surgeries were postponed, missed breast cancer screenings, delay in preventative care, diabetes death increases, cardiovascular death increases, and millions lost their employer-sponsored insurance. Some elective surgeries could be or are appendectomies, breast biopsies, removing blockage from carotid arteries, C-sections, gallbladder removal, coronary artery bypass, mastectomies, hysterectomies, and lower back pain surgery, to name a few. Delay in preventative care due to hospitals being overrun with COVID cases and clinics being closed or not seeing patients face to face. Diabetics could not get the support they needed in the way of education and nutritional support. The increase in cardiovascular death stems from the lack of cardiovascular elective surgeries and procedures, as well as screenings and in-person diagnostic testing. It's been clear that there are going to be any number of large collateral effects, and many patients at various points have been reluctant to leave home to seek treatment for fear of infection. From March 2020, the pandemic led to ICU census greater than the ICU bed capacity at 5 of 13 U.S. medical centers studied. Although most sites remain slightly above or less than full capacity, a New York City site where severe COVID COVID-19 burden was the highest, substantially exceeded capacity. Some measures to increase bed capacity for COVID cases included canceling elective surgeries and borrowing beds from wards and emergency departments. According to a Washington Post Kaiser Foundation poll, roughly 3 in 10 healthcare workers have waited leaving their profession. More than half are burned out, and about 6 in 10 say stress from the pandemic has harmed their mental health. The pandemic has impacted religion by including the cancellation of worship services of various faiths and closure of Sunday schools, as well as the cancellation of pilgrimage, ceremonies, and festivals. In April 2020, the U.S. Justice Department stated that the government may not impose social restrictions on religious activity that do not also apply to similar non-religious activity. In response to this citation of the Temple Baptist Church, members in Greenville, Mississippi, for holding parking lot worship services, the congregants listened to the church sermon over car radios while remaining in their cars. The Greenville churchgoers were still fined $500 per person. The Justice Department emphasized religious freedom in the response of any state and local government to the COVID-19 responses and sided with the church. However, the United States Supreme Court upheld the California's right to impose limits on congregations as well as secular activities in the protection of public health. As to whether the crisis had effect on long-term personal religious life, 19% of Americans said that their faith has strengthened, and only 3% said that it got worse. School closures and a shift to virtual learning. Academic performance. A study from the Brookings Institute tracked changes in math and reading test scores across the first 2 years of the pandemic using data from 5.4 million students in grades 3 through 8. They focused on test scores from immediately before the pandemic, fall of 2019, and following the initial onset, fall of 2020. And more than 1 year into the pandemic disruptions, fall of 2021. Average fall 2021 math scores were 0.2 to 0.27 standard deviations lower relative to the same grade peers in 2019, while reading test scores were 0.09 to 0.18 standard deviations lower. This is the size of the drop. For context, math drops are significantly larger than estimated impacts from other large-scale school disruptions, such as after Hurricane Katrina, where math scores dropped 0.17 standard deviations in 1 year for New Orleans evacuees. Even more concerning, test score gaps between students in low poverty and high poverty elementary schools grew by approximately 20% in math, corresponding to 0.2 standard deviations, and 15% in reading, 0.13 standard deviations, primarily during the 20 to 21 school year. Further, achievement tended to drop more between fall 2021, fall 2020, and 2021 than between fall 2019 and 2020, both overall and differentially by school poverty, indicating that disruptions to learning have continued to negatively impact students well past the initial hits following the spring 2020 closures. There is clear evidence from a study that came from the Netherlands that students are learning less during lockdown than a typical year. These losses are evident throughout the school age range and across all of the 3 subject areas, math, spelling, and reading. But students from disadvantaged homes are disproportionately affected. Among less educated households, the size of learning slide is up to 60% larger than the general population. That remote learning operated at 50% efficiency. Their results show that learning loss was particularly pronounced for students from disadvantaged homes, confirming the fears held by many that school closures would cause socioeconomic gaps to widen. Staff shortages, where this may be a silver lining for those of you looking to find jobs in the teaching industry. Nationally, the ratio of hires to job openings in the education sector has reached new lows as the 2021-22 school year started and currently stands at 0.57 hires for every open position. Additionally, the pandemic was a key factor in 1/3 to 1/2 of teacher departures. As the pandemic persists, teachers are working more hours than ever. They are exhausted and demoralized, adjusting to changing models of teaching, often without appropriate training. Surgeon General said, mental health challenges in children, adolescents, and young adults are real and widespread. Even before the pandemic, an alarming number of young people struggled with feelings of helplessness, depression, and thoughts of suicide, and rates have increased over the past decade. The pandemic further altered their experience at home, school, and in the community. And the effect on their mental health has been devastating. The American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, the Children's Hospital Association are joined together to declare a national state of emergency in children's mental health. Their declaration reads, as health professionals dedicated to the care of children and adolescents, we have witnessed soaring rates of mental health challenges among children, adolescents, and their families over the course of the COVID-19 pandemic, exacerbating the situation that existed prior to the pandemic. Children and families across our country have experienced enormous adversity and disruption. The pandemic has struck at the safety and stability of families. More than 140,000 children in the United States lost a primary or secondary caregiver, with youth of color disproportionately impacted. We are caring for young people with soaring rates of depression, anxiety, trauma, loneliness, and suicidality that will have lasting impacts on them, their families, and their communities, which leads us to some interpersonal unintended consequences of some of the measures taken to reduce the spread. While one would expect the financial, mental, and physical stress of COVID-19 to result in additional maltreatment cases, we find that the actual number of reported allegations was approximately 27% lower. How could this be? School personnel are an important channel for child maltreatment reporting. As such, our main contributions are to show that in the context of COVID-19, school personnel continue to be an important resource for the child maltreatment reporting. Researchers analyzed data on 39,331 pediatric trauma patients, of which 2,064 were victims of suspected abuse. Among children aged 5 years or older, the number of child abuse victims tripled during the study period to 103 patients, up from an average of 36 patients during a similar period before the pandemic. For school-aged children, the increase in potentially abuse-related injuries may reflect the absence of normal safeguards provided by the educational system, teachers, and social workers who have direct access to the child at school, potentially leaving a vulnerable population at risk. Economic and emotional stress, in addition to the absence of other adults in the child's life that would typically recognize and report abuse, may have contributed to rates of child abuse during the COVID-19 pandemic. While school-aged children were sheltered at home, teachers, healthcare workers, coaches, and other adults outside the family were not there to notice the signs of physical abuse. So the numbers don't tell the true story. Although many countries have reported a decrease in IPV reports and murders during the months of COVID-19 lockdown, other indicators such as emergency calls or surgeries carried out with women and IPV service providers signal that during this period there were IPV situations that were both more severe and more frequent. Many women felt trapped or could not access services to report domestic violence. The pandemic intensified many of the conditions that can fuel intimate partner violence. The World Health Organization study asked about recent changes, for example, in the past 2 weeks, to employment status, parenting behaviors, use of discipline, use of spanking, and depressive symptoms. Nearly 20% of patients had hit or spanked their child in the past 2 weeks alone. Parents perceived social isolation and recent employment loss were associated with self-report of physical and emotional neglect and verbal aggression against the child. Even after controlling for parental depressive symptoms, income, and socio-demographic factors, parents perceived social isolation was associated with parental report of changes in discipline, especially using discipline and spanking more often in the past 2 weeks. Misinformation regarding mask efficiency in the media, coupled with discrepant messaging from government officials, have led to confusion, instilled doubt, fostered anti-mask attitudes, and provoked defiant behaviors by some in response to what they see as unconstitutional mandates. Moreover, scant research validating cloth masks as an efficacious mechanism to prevent spread of infectious particles has propagated anti-mask attitudes, even when later research suggested that when worn properly, cloth or surgical face masks can restrict the transmission of the virus from infected individuals to others. Political polarization. Wearing a face mask should be considered the least controversial of major public responses to COVID-19. Unlike with many other measures, such as shelter-in-place ordinances, lockdowns, or capacity restrictions, there is no trade-off between mask use and economic activity. However, the public response to mask wearing was almost divided down political lines. In the U.S., the single most important predictor of local mask use is not COVID-19 severity, demographic characteristics, religious affiliation, social capital, or local policies such as mask mandates, but political partisanship. Mask mandates enlarged the gap. A Morning Consult poll conducted in August 2021 found that approximately 1/4 of U.S. residents do not plan to wear a mask indoors, despite surges in the COVID-19 infection. Yet another confusing political discrepancy is lower vaccination rate in Republican counties, with approximately 30% difference in vaccination rate. While other groups were hesitant towards getting vaccinated earlier in the pandemic, Republicans are currently the largest unvaccinated group in the United States and are much less willing to be vaccinated. It is important to consider the possibility of partisan distinctions in vaccination intentions. Prior research suggests that conservatives are less likely to trust medical experts, and perhaps consequently are more likely to think that vaccines are unsafe. Conservatives are also less likely to believe that the COVID-19 pandemic poses a serious public health threat due to multiple factors, potentially due to messaging from key conservative political figures suggesting otherwise, which could reduce the perceived necessity of vaccinating. On a 7-point scale measuring inclination toward COVID vaccination, Democrats averaged 5.5, while Republicans' average was below 4.0. Unvaccinated individuals are less likely to comply with public health officials' call for mask wearing in public areas. 37% of unvaccinated indicate they will rarely or never wear a mask. Bahardi and his colleagues proposed a theoretical framework that suggests that the impact of political ideology on social distancing compliance can be explained by 3 primary constructs. 1, feeling that one's freedoms are being restricted, governmental overreaching guidelines, and nanny state perceptions. 2, complacency regarding COVID, mitigation strategies, a function of low risk perceptions and COVID fatigue. And the perceived ethics of complying with these strategies. Those who wished to travel were subject to vaccine requirements and thus forego their choice not to be vaccinated. And it seems as if we missed the opportunity to use the pandemic as a potential to unite people through having a superordinate goal. How lockdowns affected college students. These stresses and restrictions associated with the pandemic have put university students at a greater risk of developing mental health issues, which may significantly impair their academic success, social interactions, and their future career and personal opportunities. Across many states, students reported stress, depression, loneliness, lack of motivation, difficulty focusing on schoolwork, restlessness, sleep, appetite changes, job loss concerns, and difficulties coping. Most wanted to return to campus and felt social physical distancing was effective, but were mixed in terms of testing or masks. 458 participants were surveyed and examined the effects of these government-imposed restrictions on social, mental, physical, and financial well-being as the mediating role of resilience. Structural modeling reveals that resilience buffers stay-at-home orders potential side effects on well-being. Specifically, individuals living in states with stay-at-home orders report lower functional well-being than individuals living in states without such orders, which negatively relates to resilience. The answer to lockdowns was remote or online learning. Yet moving to remote learning created physical and psychological stressors of their own. Students wanted to return to campus, but many did not want to take risk-reducing measures, while others wanted to continue to shelter in place and remain isolated from other students out of fear of getting COVID. While another study published in January 2021 found high levels of anxiety and depression with more than 50% students experiencing levels above critical cutoffs and females scoring significantly higher than males. The survey also suggested relatively low levels of resilience, which were attributed to restrictions and isolation, which reduced the opportunities to engage in helpful coping strategies and activities rather than enduring personality characteristics. Higher levels of distress were associated with lower levels of exercising, higher levels of tobacco use, and a number of life events associated with the pandemic and lockdown, such as canceled events, worsening in personal relationships, and financial concerns. It appears as if college students were hit the hardest. A recent study done at Texas A&M among 2,031 participants, 48% showed a moderate to severe level of depression, 38% showed a moderate to severe level of anxiety, 18.04% had suicidal thoughts. A majority of participants, 71%, indicated that their stress anxiety levels had increased during the pandemic. Less than half of the participants, 43%, indicated that they were able to cope adequately with the stress related to the current situation. Another study of U.S. college students found that the presence of COVID symptoms diagnosis was significantly associated with suicidal ideation, suicide plans, and suicide attempts, with odds of each suicide measure increasing modestly with increasing COVID-19 symptom severity. Notably, COVID-19 hospitalization was associated substantially greater risk for suicide attempts. Specifically, 12.3% of hospitalized respondents reported a past year attempt and jumped to more than 50% when focusing on respondents with underlying suicidal ideation. Yet another survey was taken of over 1.3 million Americans. The highest average frequency of anxiety symptoms was found in participants between the age of 18 to 29, which was 34% of respondents. Similarly, the highest rate of depression symptoms were found in 18 to 29-year-olds, which was 36.9%. Furthermore, the average prevalence of anxiety or depression symptoms was the highest, 49.7% among the 18 to 29-year-old group. These symptoms were also positively related to new COVID cases. In the wake of the pandemic, unique stressors such as sudden transition to remote learning, academic pressure, lesser social interactions, and limited employment opportunities have contributed to the higher burden of psychological morbidities among youth, which has a bidirectional association with initiation and relapse of maladaptive behaviors. Several studies concerning trends of substance abuse behaviors among college students, which also raise concerns surrounding the negative coping behaviors of escapism. These effects are more pronounced among students of color and those belonging to lower socioeconomic levels. People with more severe drug use problems reported feeling more socially isolated during social distancing. Those who primarily use alcohol reported higher global feelings of social connection than those who primarily use opioids. During social distancing, participants reported an increase in alcohol and cigarette consumption and a decrease in cocaine use. Lastly, those who reported using drugs for social reasons were less likely to have decreased substance use during social distancing. There's sort of a perfect storm of factors that we know increase drug use. More people are more stressed and isolated. So they make unhealthy decisions, including drinking more and taking drugs. As their stress increases, people may have fewer ways to manage it. For example, resilience promoting activities like physical activity and social interactions were not considered safe to engage in or easy to access, which can lead some people to start using drugs or use them more often or in greater amounts. The pandemic also caused many clinics and community-based organizations to close their doors, leaving people to fight their drug addictions alone. Young people need to relate with others similar to themselves in order to establish deeper relationships and look for mutual commitment, for intimacy that fosters a sense of security, company, and trust, because they need this to feel motivated to take decisions based in independence and self-determination. Viewed from this perspective, the current situation with confinement is forced isolation, and the changes it causes in learned social habits can have significant effects. Thus, as we will see, some studies have pointed out how people's losing or having to change certain habits and routines has affected their physical and psychological well-being, in addition to creating psychosocial stress. 7,012 students on the UNC Chapel Hill campus completed surveys to help study the effects of social isolation during the era of COVID-19. 64% reported self-isolating most or all the time. 64% reported clinically significant symptoms of depression. Self-isolation was significantly associated with prevalence of clinically significant depressive symptoms, loneliness, and greater perceived stress, such that a higher relative prevalence was observed for each increase in level of self-isolation. For example, compared to students self-isolating none of the time, students self-isolating some of the time were 1.78 times as likely to have clinically significant depressive symptoms. Further, students self-isolating most or all the time were 2.1 times as likely to have clinically significant depressive symptoms, respectively. In a survey conducted in Australia, adolescents' greatest concerns during the COVID-19 pandemic were around the disruption of their social interactions and activities, and feeling socially disconnected was associated with increased anxiety, depression, and decreased life satisfaction. Therefore, for younger age groups, the impacts of social isolation on mental health may be particularly pronounced. In the area of COVID-19, social isolation is widely shared experience despite high levels of social media use, particularly among young people. Students across the country reported increased levels of stress and anxiety associated to the coronavirus. However, student demographics likely play a large impact on student worry and stress surrounding COVID-19. Female students were more likely to report negative effects from social isolation, report higher rates of stress, and more readily use social media to cope with the social isolation associated with the pandemic relative to male peers. There is consistent evidence linking social isolation and loneliness to worse cardiovascular and mental health outcomes. Insufficient sleep can directly affect how a person feels during their waking hours. Examples of these symptoms include slowed thinking, reduced attention span, worsened memory, poor or risky decision making, lack of energy, mood changes, including feelings of stress, anxiety, or irritability. Long-term effects from poor quality or insufficient sleep or cardiovascular disease, obesity, immunodeficiency, hormonal abnormalities, and finally, mental health disorders such as depression, anxiety, as well as a lack of focus, leading to poor academic performance or car accidents. Data from 116 college students were examined for sleep disturbance. 57.3% said they had fairly bad and very bad time initiating sleep in the past month, while 46.2% reported difficulty staying asleep at least 2 times a week. Medication use at least 3 times a week was noted in 17.1% of the sample. Another study done at a large public university in Texas found that a majority of participants, 86%, reported disruptions to their sleep pattern caused by the COVID-19 pandemic, with over 1/3 reporting such disruptions as severe. Half of students who reported some disruptions stated that they tended to stay up later or wake up later than they did before the COVID-19 outbreak. Another disruptive impact brought by the pandemic was irregular sleep patterns, such as inconsistent time to go to bed and to wake up from day to day. Some, 7%, reported increased hours of sleep, while others, 6%, had poor sleep quality. Well, what can be done? Increasing resilience. Most of all the literature points to increasing resilience. This, I think, is the number one thing that we can do to mitigate the psychological effects of not just COVID, but any undesirable situation. What is resilience? Resilience is a person's ability to resist possible psychological trauma caused by a problematic and harmful environment. It is, therefore, the result of an internal drive to heal, of the human resistance to a condition, resistance which leads one to reject resigning oneself to suffering or reality itself. This is, thus, an acquired ability resulting from a person's adaptability to traumatic situations. According to several authors studying resilience, they find the quality and quantity of a person's physical bonds and social networks, or life capital, are a protective factor, since successful coping is more positively related with offline social capital, physical relationships, than with online social capital, virtual relationships. The variables that these studies have found to be important in building resilience are family cohesion, breaking isolation through sustained virtual communication, and finding motivational tasks that create funny situations through one's sense of humor. One author found frustration, malaise, and decreased resilience to be the main problems in students who either do not engage in physical activity or frequently watched pandemic-related news. Factors that contribute to resilience. Factor number 1, persistence, tenacity, or self-efficacy can be defined as the ability to handle the challenges of a situation, to look on the bright side, and to perceive oneself as a strong person. Students with high and solid levels of persistence also possess high and solid resilience. But there was also an important percentage of students with low persistence who still had high resilience. This suggests that when people have traumatic experiences, they adapt to these new situations and view themselves as capable individuals. And this, in turn, allows them to subsequently adapt more quickly to new adverse situations. Therefore, the fact that some students with low persistence still presented high resilience might be explained by their having been through similar situations previously. Factor 2, control under pressure can be defined as the ability to be in control of adverse or stressful situations by taking decisions, turning problems into opportunities, and regulating one's emotions. As with the previous factor, higher control under pressure equals higher resilience. Yet no student with low control under pressure had high resilience. Likewise, no student with solid control under pressure showed low resilience. This factor, therefore, appears to correlate with the ability to self-regulate and control situations in order to make decisions. Adaptability and support networks, factor number 3, is the ability to cope and adapt to change that stems from possessing a will to succeed and having supportive relationships. It is possible that the student with high adaptability and support networks maintain certain habits from their daily lives, albeit with light adaptations to the new reality. This high adaptation to the new reality of the confinement exerts a positive effect on physical and psychological well-being. Also, being able to take classes online and to preserve certain studying habits as well as maintain social relations with classmates, pursue social support, may explain the high adaptability shown by the participants in the study. Factor 4, control and purpose, can be defined as a person's ability to act with balance, decision, and a clear sense of purpose in spite of the unfavorable circumstances. Another interesting finding to emerge from this study is that students with the highest rates of control and purpose and resilience were the youngest ones. This could be directly related to how fear is perceived. According to some studies on evolutionary psychology, young people have fewer cognitive tools for assessing threatening situations, which allows them to view the confinement with less fear. Since fear is a prime contributor to emotional problems, young people's lower fear leads them to score higher on resilience. Healthy coping response, self-care strategies. Having a healthy coping response can be particularly helpful for building resilience in response to disasters. People who cope by taking charge of the situation, engaging in proactive behaviors, acceptance of the situation, and allowing oneself to face traumatic thoughts have a greater chance of being resilient. Another study found that people facing the previous SARS epidemic coped by employing 3 different types of strategies: active strategies, facing the stressors as well as the things that lead up to them, and taking actions to reduce stress. Avoidance strategies, for example, denying the source of stress or using substances, or by seeking social support. They also found that those who tend to avoid had more psychological distress, while those who used more active approaches reported greater satisfaction with life. However, they encouraged the use of a range of coping strategies rather than sticking to just one, because during times of high stress, Any kind of coping can reduce negative consequences. Healthy coping, therefore, can help people deal with the stress of COVID-19 more effectively and build resilience. In fact, in a review of articles related to the current pandemic's effects of well-being, perceived control, social support, need satisfaction, and habit were found to be productive factors. Some recommended coping strategies specifically mentioned in relation to this pandemic include deep breathing, decreasing exposure to the news, avoiding unhealthy numbing such as drugs and alcohol, having agency in one's life, helping others, and maintaining a connection to others. Finally, focusing on physical health can improve self-awareness, increase immune response, and also boost mental health. For example, having a routine, getting regular sleep, engaging in exercise, sustaining social connections, getting exposure to sunlight and nature, consuming a healthy diet, including fresh fruits and vegetables. Hoping mental health problems such as anxiety and depression will go away on their own can lead to worsening symptoms. If you have concerns or experiencing worsening mental health symptoms, ask for help when you need it. Be upfront about what you're doing to get help. Here's what you can do. If you're a student at ASU, please call or come by the counseling service and schedule an appointment with any one of the trained counselors, Monday through Friday. Contact a close friend or a loved one, even though it may be hard to talk about your feelings. Contact a minister, spiritual leader, or someone in your faith community. Contact your employee assistance program, if your employer has one, and ask for counseling or a referral to a mental health professional. Call your primary care provider or mental health professional to ask about appointment options or talk about your anxiety or depression to get advice and guidance. Some may provide the option of phone, video, or online appointments. I hope you found the information presented here useful, and there's any number of things that you can take away and incorporate into your daily life. Here's a list of resources and references that I use for this webinar. Thank you for your time.